Okay, thank you for coming. We are having a public lecture about headache. My name is Yumi. I'm an acupuncturist and Chinese herbalist from the Trium Chinese Medicine. So let's talk about headaches. So I will talk about how the Western medicine sees headaches, how they differentiate headaches, and then I'm going to talk about how Chinese medicine sees headache and we understand and treat headaches. Then I'm going to talk about different headaches, headaches that happens in the back of the head, starting from the neck, or headaches on the side, temporal headache, and headache on the front, and headache that's in the top of the headache. Yeah, and I will introduce one of the case that I recently had, and I had a really good result from this person. So I would like to introduce the case first. So headache, how Western medicine sees headache. They first differentiate headaches in three different types. One is a primary headache, and this is actually same as a Chinese medicine. Primary headache, which is standalone headache. You have a headache because something imbalance is in the head. It's a head issue. It's a tension headache, cluster headache, migraine headaches. Or secondary headache. This secondary headaches is the side effect or byproducts of other drugs or issues. Alcohol, recreational drugs, hangovers, food sensitivities, other side effects of other drugs. And cranial neuralgias, facial pain, other headaches such as trigeminal neuralgia, Bell's palsy, post-stroke facial pain. Those are the three big types of the headaches that the Western medicine differentiate. So how the Western medicine commonly treat headaches and headaches? First, your doctor will recommend rest in a quiet, dark room. Hot or cold compress to your head or neck. Massage and small amounts of caffeine. Small amounts of caffeine works, especially if it's diluted like a coffee, because in Chinese medicine, because coffee is diluted, so it releases the accumulation of dampness from the lower area. But because this closet gets cleared, this dampness descends, and then I think that's why it helps. Over-the-counter medications such as ibuprofen, acetaminophen, and aspirin. Prescription medication, so if it's more severe, you would need to be prescribed special medications, including those medications that I'm not even trying to pronounce. Then preventative medications such as these, and I have no idea what exactly it does, but that's what I did get from the quick research how the Western medicine treats headache. I think taking over-the-counter medication is the most common. Take Advil or Tylenol is probably the most common way for people to treat headaches. So how Chinese medicine differentiate headaches? We first differentiate headaches in by region. Where is the headache? Is it at the back of the head, side of the head, or top of the head, front of the head? So if it's the occipital, back of the head, it's usually tension headache. Tension from tight neck and shoulders. Very common, very common. So they will know, they know this type of tension. So when they're office work, seated job, computer job, for postures, and then shoulders, between scapulas get tight, neck gets tight, and then or the nape, and then this muscle is one muscle, trapezius muscle, so it gets all tight and then cause headache. Side headache. The side headache. Usually people get one side, either alternate or rarely have both sides, but can happen. So side headache is qi, heat, fire rising up. It's usually rising up kind of headache. Frontal headache is dampness rising up or retention of the dampness. So dampness is usually produced in your digestive system. So for whatever reason, it can ascend and give you a headache. But when this happens often enough, the dampness will decide to retain in the head, and then it can give a constant headache 24/7. The case I will show you later, this is the case that the constant headache 24/7. So it was very debilitating, like it was really bad. Top headache will be a deficiency of the blood. So you don't have enough blood due to the overuse usually. You work too hard, so you don't have enough blood, and then you will get a headache. Other common headache, pressure behind the eyes, that's damp retention. If it's the pressure from inside out, the pressing the eyeballs out, that's pressure retention. So this is similar with frontal headache. They may have commonly or often, very often they have both together. Throbbing headache. Whenever it throbs, there's a heat in it. When there's a throbbing pulsation, there's a heat component in it that needs to be cleared. And severe migraines that pain medicine doesn't work. This is a type that comes with hopelessness. When it's very severe, it may even give you suicidal thoughts because it's just so debilitating. And that's usually excess cold. Rare, but I have seen. This type can have like the visions, auras, and then like there's nothing can be done except like you have to just sit in a quiet room, dark quiet room, and then wait till it's over. This is a horrible type of headache, and if you don't have it, it's blessing. So we also see, and then if you ever come to my sessions, I always ask what makes the symptom worse, what makes the symptoms better, because it matters to me what makes it better or worse. So when it's worse with being outside, and then when it's being worse, it's worse when it's exposed to wind. It is pathogens outside. The reason the etiology is the pathogens outside. Like it's just and it's not. I'm not talking about the virus or dust that you may commonly know, but the Chinese medicine sees the 6 external pathogens like wind. There's a cold. There's a heat. There's a damp heat. There's a dampness. Dryness, like there's we recognize 6 external pathogenic attacks, and then the wind is one of them. Wind is the first pathogens that enters a person, and the other pathogens like a cold or damp usually follows after wind. Wind, we call that arrowhead, and then the entry point of the wind, it's here. This is where the wind enters. So if you are outside when it's windy, without scarf or without when your neck and nape is exposed, this can happen. Worse with changes in barometric pressure. Barometric pressure is like a pressure outside, and this is very common. You hear people say like headache when the pressure changes is this. This is a dampness in the head. I will explain about it later. Worse, if the headache is worse with humidity and rain, this is same with this. It's a dampness in the head. Worse with certain food. People often say gluten gives me headache or wheat gives me headache. It's not wheat's fault or gluten's fault. It's just that your poor digestive system can't digest those items, and then it will create undigested material in the food, which generates a pathogenic dampness. So it is dampness. Then worse with stress, very common. Disturbance in the qi movement, because the stress can impair the qi flow, the flow of the qi. So this can happen to the head and from the head. So the flow of the highway of the qi is disturbed and then cause a headache. Very common. Worse in evening and nighttime. This is the deficiency of blood, and this can combine with anything, but especially if that combined with the daily timing when the headache is worse, and if it's at nighttime, it's a deficiency of the blood. Worse with desk work, sitting, inactivity is same as stress. It's a disturbance in qi movement. This type of headache gets better with if you take a half an hour break, not half an hour break, like a short break every half an hour, and then like moves around. It helps. It's mainly like because you're doing this for so long, it's just the flow of the shoulder and neck is just not happening. And worse with overdoing and fatigue. And this is also deficiency of blood. This is more like you're overwhelmed and then you're tired, you're done of the day, and then you just want to be in a dark place, quiet. And then that's the time, this is you just used up your body fluid, your energy, and then your blood. So you get headache. Any questions so far? Good? Okay.